Hello everyone. Yes, today's topic of discussion is pregnancy skincare, and we already had a lot of questions from people around this topic. So we are going to address all of them in this session. Hi, Dr. Swati. Yeah, and our guest today is Dr. Swati. She's a dermatologist. Just let me add her.
Hey,
Hi, Vidya. How are you?
hi. I'm good. I'm good.
I'm just adding Dr. Swati. She's already
Yeah,
here.
yeah.
Hi, how are you?
Hi.
Hi, Dr. Swati. Lovely to
Hi, hi.
lovely to have you with us
Same
today.
here. Same here. Looking forward. How are you all? All good?
Yes,
Yeah.
Okay, super.
it's been such a long time since we've last spoken.
I
Lovely
know,
to.
yeah, I've been a while. Y'all have been busy doing lives and
No,
good stuff
you
y'all
are
are doing for.
that's what Vidya informed me as. That Dr.
Yeah,
Swati is here.
same thing.
Sorry about last time. Yeah, last time I got a little stuck with something.
No,
Yeah,
no,
no issue.
not
Thank you
for
so
the,
much.
yeah,
Thank you
Mm.
so much for
not,
joining us today, and we
Mm.
definitely understand you have a very busy schedule, but thank you so much for taking out the time and
Pleasure, pleasure.
being with us
Good.
here today. Yeah, today's topic, it has already kind of like caused a stir among people. So there were so many questions we had. I think we have somewhere around 8 to 10 questions. Okay,
Super.
all different questions from people. So we will take them up at the end of the session if we haven't covered them so far, like, in Vidya's question.
Sure.
Yeah, before we begin, Dr. Swati, we would love to, we would love to have you talk a few words about yourself. Like if you can give a brief introduction about yourself.
Sure, sure. So, hi guys, I'm Dr. Swati Mutha. I'm a practicing clinical and aesthetic dermatologist and even a hair transplant surgeon. I'm practicing in Bombay, Breach Candy area. I've been in practice for last 10 years. I've done my fellowship in pediatric dermatology also from Singapore. So, I really loved the kids and the pregnancy and all of this. So, I went to Singapore to pursue a course there. So, yes, and I'm looking forward to this session with these really hardworking, enterprising mothers. Y'all have done it. Y'all are doing an amazing job. I really love what y'all are doing, and it's a very good initiative because there's nothing much for post pregnancy as what your focus is the yes for the new mothers.
So much. Thank you so
ju-
much, Dr. Swati, for
just
that.
to add on, she is one of our expert panel doctors as well.
Yes,
It's my
so she
pleasure.
has a very a very a huge chunk of contribution in the courses that we have come up with. So yeah, she is there. She is actually a part of New Mother already. Yeah.
Yes, happy to be, proud to be.
Yeah. So shall we start with the first
Yes,
question,
please,
Dr.
let's
Swati?
start.
Yeah.
Yes.
So, my first question is, how is pregnancy skincare different from the normal kind of the routine skincare that we usually may be having or doing?
Okay, okay. So yes, what you're saying, it is different. That's a fact because see, as we know, a lot of changes take place during pregnancy. If you remember, like when I got pregnant, like my taste buds had changed. I was a different person altogether when I was pregnant. Like things I used to love, I used to hate the most. I used to hate, I used to love the most. So it's a completely different phase of your life. There's
Yeah,
so many changes. I'm not just talking from skin. Skin is just a part of it, but beyond, besides skin, like we are a complete different. Like there's a person living inside us. So of course, just imagine like how the life is totally different. So from skin
Yeah.
point of view, multiple changes take place because of the changing hormones, changing immunity, weight gain. Physiological changes of pregnancy only bring about a lot of changes in skin as well as hair. Hormones, thyroid, diabetes, all of these changes take place. So because of that, the implications on skin and hair are also there significantly. Skin tends to get dry, some people get oily skin. Some people, because they're on supplements to sustain the pregnancy, like vitamins or some progesterone or anything, all these things also affect skin and hair. So there are a lot of changes which take place. Hair, touch wood, in most of the cases gets better during pregnancy because the pregnancy hormones are really good for the hair. So we don't need to talk much about hair. But post pregnancy, of course, the hair falls also. But during pregnancy, hair is in the best phase, surprisingly. But skin, some people have amazing glowing skin and some people have really bad acne, pigmentation, all of this. So it's very, very different. Every individual responds differently depending on the issues they face. So yes, there are a lot of changes which take place and which need to be handled individually also.
Right. Thank you. Thank you so much for that wonderful explanation, Dr. Swati.
Is it necessary to you? Is it necessary to use only natural ingredients, or we can use? I mean, which are the safe chemicals to be used?
Yeah. That is one of the most common questions. Me also, as a dermatologist, we come across like first thing patients. And see, to be honest, there's so much like chemical now. It's become like I just did a post also a few weeks back on chemical. Like, थोड़ा mental block भी है. मतलब chemical means it's bad. First of all, not everything has chemical. Whatever, water is also a chemical if you see.
Yes.
Okay, so
Yes.
good, bad is has to you should know. Trust your doctor, your gynec, dermatologist, whoever, and consult them. Don't just randomly use. So what I tell my patients, like pregnant females, is first 3 months, as soon as you get to know, okay, now you've conceived, just stop all your actives, I would say. Any serums, active ingredients basically, serums, retinol, vitamin C, kojic, whatever you're doing, just stop for once. Okay, speak to your dermatologist ideally. In case you can't speak, for first 3 months, minimize your routine. Why first 3 months? Because first 3 months is a time where the organogenesis, the organ formation is happening in the baby, for the baby, right? All the organs are forming, the formation stage. Then is the growth stage. एक बार बनता है first 3 months में फिर वो size बढ़ता है, right? So first 3 months is very, very critical. If you're not aware, like if your dermatologist is saying you can use, you should. But if you're not consulting everyone, if to give you a broad idea, stop everything for 3 months. Just use a good cleanser, moisturizer, and a physical sunscreen. Physical means something like a zinc oxide or titanium dioxide based sunscreen which are like actual blocks. I would suggest use them because pregnancy में pigmentation के chance भी बहुत बढ़ जाते हैं. So if you
Right.
start using sunscreen initially, it's very good. Okay, do that. Another thing which you should start doing in first 3 months is moisturizing your skin because skin is going to expand. First 3 months तो इतना नहीं होता है, वो stretch होगी, expand होगी. So hydration is the key. Keep it moisturized. You can do oil massages, do your moisturizing routine. So all this is very, very safe. Do it for 3 months. Now, after 3 months, if there is a specific issue, like some people start getting acne, some people get pigmentation, some of the pigmentation is physiological also, very normal. It happens in pregnancy, usually goes also post, once you deliver the baby in next 3 months, it goes also. But if you want to do something for that, then you can do the chemical ingredients like any active molecules basically. But speak to your doctor, consult a dermatologist, and then you can do a lot of them are safe post 3 months. So you can safely start using even anti-stretch mark creams and all that. After 3 months, you can start using, but don't do it over the counter or anything. Just speak to a doctor and then start anything. Because a lot of these things which so-called natural, you don't know under kya hai, what is happening. So it's always better to consult somebody and then start using.
Okay. Thank you, Doctor.
Yeah. And what are the best practices during the pregnancy for skin?
Okay. So best practices, as I just told you, it's not just about applications. It's about even internal practice, what you should do. See, pregnancy के जो main issues होते हैं, sometimes it happens most of the time because when the weight gain is excessive, right? Just first of all, focus on diet and exercise. Eat healthy. Continue your exercise, whatever your gynec is allowing at whichever level. According to that, yoga, walk, whatever, please continue that. Okay, because that is the most important thing. Along with that, as I told you, see, one of the first thing that comes to everybody's mind when you think of pregnancy, stretch marks. Stretch marks. Okay, because obviously it is bothersome. It doesn't look nice, and most of us nowadays we want to wear or something, so we are conscious about it. So key to preventing stretch marks. See, beyond a point तो genetic होता है. किसी किसी को नहीं भी आते हैं, किसी किसी को बहुत आते हैं. ठीक है? But to prevent it, ideal first thing is moisturize. 2-3 times a day, whenever you're sitting, all these like breast area, abdomen area, thigh, buttocks, the areas which are going to expand and contract the most. वहां पे
Mm-hmm.
start applying moisturizing. You can use some natural oils, moisturize anything. So that is one thing for the body you need to start doing.
Okay.
Face, I told you initially just do a cleansing, moisturizing, and sunscreen routine. Then, depending on the skin need or whatever your requirement is, you can start using any active ingredient as per your doctor's recommendation.
Okay.
Okay. Do you s- do you suggest face scrub? Is it okay?
So I would suggest during pregnancy, don't do scrubbing too much. You can, if you want to do, you can do very, very fine scrub, not those hard scrub. And that also like once in 3-4 weeks. Don't do it very often. Two
Okay.
reasons. One is already the skin tends to get dry and stretchy during pregnancy. Okay, dry skin को आप rough करोगे तो irritation का chance है. Okay.
Mm-hmm.
Second is also what happens during pregnancy is pigmentation. So anything
Mm-hmm.
when you rub too much tends to get darker. So if you would have noticed, like our underarms, groins, all of these areas are much darker than our normal because these are friction areas. So जहाँ भी friction होएगा. So scrubbing is also kind of friction.
Right.
So excess friction, excess of it is. I'm not saying scrubbing is bad. Too much scrubbing is not a
Mm-hmm.
good idea. Once in a while, you can do some gentle DIY home remedies, some very fine scrubbing at home, but not very often.
Okay.
Okay. Okay. So can changes in skin indicate any skin related issues, and when should we approach a
Yes,
doctor?
that's a very good question. So, there are changes which take some are physiological changes and some are pathological changes. Okay, physiological changes which are bound to happen, like some people get these pigmentation on the neck, pigmentation in the abdomen area, किसी किसी को neck, underarms ये सब पे because of this weight gain, it can happen. थोड़ा बहुत pigment. Some people get acne also because if they are on any hormone injections or generally also pregnancy hormones can cause acne. All these are
Mm-hmm.
still okay. Stretch marks is normal for pregnancy. But when do you need to worry? Okay, so when you see the changes like excessive, like the skin around the neck and underarms get really thick and dark, you start getting
Mm-hmm.
pigmentation in this area. That is one bothersome. Bad acne is something which you need to tackle that time. Another
Mm-hmm.
thing which you need to is infections are very, very common in pregnancy. All kinds of bacterial, fungal, as well as viral.
Mm-hmm.
Why? Because there's a weight gain, you tend to put on weight. There's more perspiration.
Mm-hmm.
There's a lot of sugar craving and indulgence into food, thinking that we are pregnant, we can eat anything. So, because of excess sugar, improper diet, there is a chance that you can get fungal infection, some bacterial infection. Skin is also dry, right? So, the barrier of dry skin होती है तो peel होती है, right? तो
Right.
barrier missing होता है. So, there are more chances of you catching hold of bacteria. Like उस पे अगर waxing करोगे, which you normally do. But pregnancy में waxing के बाद folliculitis का chance, boils के chance ज़्यादा होते हैं because your skin is already dry and then you're stripping a layer.
Yeah.
Okay, so all of these can happen in pregnancy. So if it happens, just speak to your doctor. These changes, any kind of fungal infection, itching in the groin area, under the abdomen because of the belly. Obviously, because
Mm-hmm.
see, normally you're not used to that. But when the breast or the abdomen has increased, these folds tend to accumulate sweat and everything. तो यहाँ पे fungal infection का भी chance हो जाता है. It's better to treat it soon because then you'll need some oral और उससे अच्छा है कि आप cream से उसको treat कर सकते हो. It is always better. And post
Mm-hmm.
delivery, then you'll be feeding, and also it's better you clear everything before you deliver the child.
Yeah, makes sense.
Yeah. So, does the darker neck, the darker skin here behind the back indicate gestational diabetes? Uh,
Yes.
yeah,
So I
please.
told you physiological भी थोड़ा darkening होता है weight gain के कारण. But what is the alarming sign which you need to test for the diabetes? It when it's like thick and velvety, like ऐसे velvety appearance हो जाता है ना, और बहुत ही
Mm-hmm.
thick हो जाती है वहाँ की skin, neck की, underarms की. So then you need to get yourself tested because that can be a sign of gestational diabetes. Also, sometimes not just diabetes, it can also be a sign that you're doing excess sugar in your diet or your metabolism is not correct. But whatever be it, speak to your gynecologist, speak to your physician, and get yourself tested.
Okay.
There's also
I
something called as skin tags, right? That usually happens during pregnancy.
Yes,
Is that
yes,
also
yeah.
related to gestational diabetes?
Yes, that is related generally to just metabolic issues, okay, and the weight gain also, which both, and the hormones, which all of this happens in pregnancy. But skin tags, very common. A lot of them fall off also, some of them remain, which can be removed, but technically they're harmless. So there's nothing to stress about it because they are not infectious, they're just cosmetically, they look ugly. Otherwise, they are not at all infectious. They don't trouble you. And that you can tackle post your delivery and everything. But yes, it is a sign if the sudden outburst of a lot of skin tags, show it to your doctor. It could be a sign that you could be having any hormonal issues.
Okay.
Okay. And how about waxing? I mean, is it safe to wax and to during the entire pregnancy? I've heard like, they don't, they suggest not to do it in the last, when they are due and all. They say no,
And
after five
alternatives
months you
also.
can.
And alternatives to
Ah,
vaccine also. If you
yeah, yeah,
suggest that don't wax, then what are the alternate options?
Okay.
yeah.
First of all, there's no contraindication or there's no reason to not wax because it is absolutely safe. There's nothing going in your system. Okay, so
Mhm.
you can easily wax. Sometimes just when there is, as I told you, when the skin is too dry, and some people post 7 months so tend to get a lot of these rashes, PUPP, and all these different kind of skin rashes. And skin is stretchy, itchy bhi hota hai because
Mm.
as the skin is stretching, no, khujli bhi chalu. So that's why they say कि avoid waxing when the skin is little irritated. That's the
Okay.
only reason to say not to wax in the last trimester. But otherwise, there's no issue as such that it will cause any harm to you or the child in terms of waxing. There's nothing like that. You can easily wax. If not waxing, if you feel the skin is sensitive, then you can shave or trim. That's the best way. Instead of putting those wheat, I would prefer shave or trim because again, there are a lot of chemicals in
Right.
wheat. So if needed, shave or trim. To be honest, now even lasers are safe in pregnancy. So they have
Okay.
been it's been proven that even you can even do the laser hair reduction during pregnancy, post pregnancy, before because it doesn't go beyond skin deep. So you
Okay.
can look at any of these alternatives.
Okay.
Okay. So any skin related issues a mother is having, can it be transferred to the baby as well?
Not not most of them, but some of the rashes and even some of the genital infections if it happens. Okay, if there's a normal vaginal delivery, if there's an infection in the genital area, then there is a chance. That's why I just told you it's better to tackle all these infections, fungal, viral, which can happen because in pregnancy, immunity is also very unstable. Like we always tell pregnant ladies, agar kuch infection hai, to because the immunity is not the best, keep away because immunity is low during pregnancy, high chances of infection are there. So if it's in the genital area, if it's in a vaginal area and there's normal vaginal delivery, there is a chance like sometimes fungal infections can be transmitted to the kid. The kid is born with an oral thrush, what we call like a oral candidiasis, oral fungal infection. So that's why as soon as you start doubting it also, show it to your gynac or your dermat and or your physician, get it treated soon before you deliver to avoid any chances.
Okay.
Okay.
Yeah, then also one thing, the vagina tends to get dark during pregnancy. And then for most of the women, it does not really get back to its pre-pregnancy state and it continues to remain in that way. So is that just a cosmetic issue, or is this something that people really need to consult a dermatologist for?
So, to be honest, it is a cosmetic issue. It's a part of the whole pigmentation thing which happens during the pregnancy, like all the folds basically, which tend to get darker. Okay. So, there is no medical issue as such in this. It is a normal part of it. In lot of people, it tends to get back to its normal color also, but in most of the cases, it doesn't. The darkness to an extent remains. You can lighten it with using creams and other methods, but technically, there's no issue as such except the cosmetic part.
Okay, so
Okay.
it can be it can be treated if consulted,
Yes. If you're concerned about it, there are various ways of lightening it and getting it back to the skin. Also tends to get loose in that area. All of this you can be. No, you don't necessarily need to do machines. You can even do creams and get them to normal kind of normalcy.
Yeah. So,
Okay.
should we take up questions from the viewers, Vidya, or you still have questions?
I have, but I think we can keep it a little at the end.
Yeah, yeah.
Yeah.
I just want to answer, want Dr. Swati to answer these questions. Okay, the
Yes,
first
sure.
one is skin darkening and how to resolve after post-pregnancy. So she has not really mentioned which skin, which part of the body. I think this is
Hmm.
just a generic one. If you can answer it, Dr.
Sure,
Swati.
sure. So skin darkening, of course, happens on the face, which is called the chloasma kind of pigmentation जो होता है. Face पे होता है, neck, underarms, abdomen, neck lines, all of these lines tend to get darker. So pigmentation is one of the very common things which happens to almost every other female to some or the other extent in pregnancy. Most of it is reversible. Most of it. Okay. If provided you shed your excess weight, get into a better diet. If you continue to be overweight post the delivery also, then there are high chances that that pigmentation will remain because somewhere it's related to your metabolism also.
Okay.
There's something called as insulin resistance, the gestational diabetes it's related to. So it may not be proper diabetes, but something called as insulin resistance, it's too technical. Anyways, so if you lose your weight post the delivery, then there are good chances that most of the pigmentation gets lighter. But if not, there are very good creams available which you can start using immediately post your delivery, and that will really help to lighten the pigmentation areas.
Okay, so it's best to consult a dermatologist once. Like
Yes,
actually, I'm
yes.
just reading out the questions from here, so I'm not able to see your name here. So you can actually consult a dermatologist and then start on with some treatment. And I think it's very much curable. Nowadays,
Yeah.
there's so much of advance
Yeah.
in yeah technology. Okay, the next question is: I had scratched on my stomach when I was pregnant. Now there are giant marks on stomach. So she wants to know how. Is it really because
Okay.
of scratching or yeah, I think
So
it's
to be honest, sometimes you feel this the mark is because of the scratching. It could also be a stretch mark, which maybe you're confusing. But anyways, for any kind of scar, as I said, first of all, pregnancy में skin stretch होता है, dry होता है, बहुत ही sensitive होता है because it's stretching. Just imagine कुछ खींच रहे हो तो वो बहुत ही नाजुक है. It's very delicate. So you have to handle it very delicately. Any kind of injury will make it worse, will cause tears, will cause scars, injuries. Okay. So you have to handle it. So best thing what again I'm saying is moisturize. Keep it hydrated because it helps to strengthen the skin. Okay. Now, once the scar ban gaya hai, be it a stretch mark or a scar because of your scratching, you will ideal is for stretch marks as well as for scars to start using scar creams as soon as possible because एक बार old हो जाते हैं scars, it's very difficult to get rid of them. Like stretch marks also एक बार white होने के बाद it's very difficult. Like you can maybe 20-30% with doing lasers and stuff you can minimize them, but to completely get rid of or to make them really less, it's very difficult.
Okay.
okay. Thank you for that, doctor. Actually, since we were talking about hydration and moisturizing, there's a user who has just asked the question, learn, tap, devo, repeat. So the question is, can you suggest any natural oils for stretch marks or any natural cream?
So again, natural is natural, but you can use most of these oils depending on the season. I like coconut oil also, almond. If it's winters, you can do one of these heavier oils like almond oil, olive oil, or any of these. What I was saying, there's a very good paraffin oil based application which are really natural and not very sticky also, especially for summers because you don't want to put oil in the day because then it'll be sticky, then you'll get fungal infection, kuch dusra complication aa jayega. So you can go for light oils, liquid paraffin based oils are available in the market. So go for them. Go for that. Also, what you can do is oil before the shower. Half an hour before the shower, oil kar lenge na. And then if you take shower, a slight layer will remain. So
Yeah.
then it won't make you very sticky and sweaty in the summers.
Yeah, that's a good one. And also, Dr. Swati, I just had this in my mind. Along with moisturizing, drinking water is equally important, right? To keep your skin
Very.
hydrated. Because the less water is there in the system, the more the skin. I don't know.
Yes,
I think you will be
yeah.
better able to put it up.
No, absolutely. So drinking water, eating good fats also make a lot of difference to your skin hydration. Good fats as in seeds, nuts, avocados, uncooked olive oil, uncooked ghee. All of these are really, really good for to naturally hydrate the skin from inside.
Okay.
Yeah, so ghee is really important and water is also really important. Yeah. The
Yeah.
next question that I have is, can we do bleach on face during pregnancy?
So again, first 3 months, I tell my patients avoid it. After that, also, like some people, I first ask them, what are you doing the bleach for? If it's for hair or to become or to reduce that pigmentation, patchy skin. So if it's just for the cosmetic reason or they don't have any social big thing happening, then I tell them to avoid it. Okay,
Okay.
suppose if they have a wedding to attend or a social function to attend, I'll tell them once do it, but don't do it very often. Don't continuously keep on doing it as you normally do. But once in a while, for a big function, event, something, you can do it once. That's fine. But do the oxy bleach, which is comparatively less harmful.
Does bleach harm the skin, doctor, even under normal circumstances? Like even if, like, say you're
Uh,
not pregnant, it's
Once in a
harmful.
while, again, doesn't. Once in a while, doesn't. But regular use of bleach. So, bleach, the word only says it's a bleaching agent. ब्लीच मतलब वो आपके आपके ऊपर ब्लीच कर रहा है लाइक हाउ व्हाइट क्लोथ्स पे हम ब्लीच करते हैं ना इट्स लाइक अ chemical. It's a harsh chemical. At the end of the day, it's bleaching your hair, bleaching your skin. Once in a while is fine. But if you're doing it repeatedly, it can cause a little bit of subclinical. Like आपको, you won't realize it that it's causing some irritation. But धीरे धीरे, if you've done it like 20 times, after that, that irritation turns darker, and yes, you'll start noticing then the skin has turned darker over a
Oh,
period of time. So
okay.
that's the only, like, it doesn't
Yeah.
go in your system or anything, but just the local irritation because of the bleach can lead to darkening over a period of time.
Okay. Thank you. Thank you for that, doctor. Next question is, actually, we have, like, it's much more than 10 questions. Some questions, like, most of the questions are repeated. So I'm just going to club some
Sure.
questions. Stretch marks, how to prevent them, stretch marks again, stretch marks again. So we have, like, whole lot of people asking about
Yeah,
stretch marks.
yeah, that's
Okay,
the
stretch
most
marks and
common
how
thing.
to prevent stretch marks. I think we have some, maybe like 35 questions on stretch marks. Yeah, so it's a hot topic.
Yeah,
Yeah.
it's a hot topic. Yeah. So stretch marks prevention is first most important, slow and steady controlled weight gain. First 6 months, we are all because of nausea, we feel very happy, हाँ weight gain नहीं हुआ है, weight gain नहीं हुआ है. And then last 3 months, that sudden weight gain of 10, 12, 14 kgs can do all the harm. Sudden skin stretch होगा, sudden होएगा, तो ज़्यादा chance है stretch marks से. Slow, steady, controlled stretch, skin gets time to adapt, used to strengthen itself. ऐसे खींचोगे तो फटेगा ही. ठीक है? So first is slow, control your diet, exercise, very, very important to prevent stretch marks. I'm not talking about anything else right now. Okay. So controlled, steady weight gain. Next important thing, hydration, internal as well as external. The more your skin barrier is strong with the good fats in diet, skin का भी एक lipid barrier होता है, fat का barrier होता है. तो वो internally, as I just mentioned, the good fats, उसके साथ आप strengthen कर सकते हो. Drinking enough water, keeping yourself hydrated, and then moisturizing with the oils, moisturizers, all of this. Okay, regular moisturizing 2 to 3 times a day, very, very important. Okay, all these are prevention of stretch marks. You can start using anti-stretch mark creams also, which start working just when you start, like अभी damage होना चालू हो गया है, तो you can start using these creams ताकि ज़्यादा वो scar नहीं बने, ठीक है, so that they don't turn white. Speak to your doctor and get a good stretch mark creams. You can start using after 3 months safely. A lot of these stretch mark creams which are available can be used from second trimester onwards. So start using them.
I just have one question here, doctor. This just came out, like, my own thing. So when we talk about anti-stretch mark creams, okay, do they really work as anti-stretch mark, or actually they are, like, intense hydrating or moisturizing creams, which kind of, like, give your skin that kind of moisturization? Is there something really called as an anti-stretch mark cream?
Yes, 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 yes. So there are scar healing creams, like how you have stretch mark is a scar. It's a injury के बाद जो scar होता है, it's a scar. Okay, so there are a lot of ingredients which help in scar remodeling. But again, not when it's turned white. जब वो red रहता है, जब वो खींच रहा है, when just skin injury has just happened, that time if you use it, then only it will help it heal better. It's not going to
Okay.
stop your stretch. Healing better हो जाएगा तो stretch marks इतने खराब नहीं दिखेंगे, बहुत ही minimal scar आएगा आपको.
Okay. Okay. Yeah. That was an important piece of information.
Hmm.
So then, like, if we talk about few anti-stretch mark creams, can you are you in the position of giving out a few names? If you can
Sure. So
mix
sometimes
that.
the stretch
Yeah.
marks creams which are safe to use in pregnancy are, there's something called a stretch rid cream, elastoderm cream, and then there's Sebamed ka anti stretch mark creams. That's also very nice. So I think these 3 4 are really good.
Okay.
There's Clarins ka I had used during my pregnancy. It's called Yule tonic. It's a bit expensive. It's like a oil base, but it has a lot of anti-scar, anti-stretch mark ingredients. So that also, just putting 2 3 drops every day during your pregnancy also really helps.
Okay. Thank you. Yeah. I'll just go on to my next question. After my delivery, my skin got darker. What is the reason? What's the solution? I think we've discussed this, right, already. It's related to
Yeah,
pigmentation only.
pigmentation.
Another question on pigmentation is like I have pigmentation all over my face. I'm taking all vitamins, magnesium, calcium, but it's still not reducing or fading away.
Pigmentation, right? What was the question?
Yeah, I'll just repeat it. I have pigmentation all over my face, and I'm taking all vitamins, magnesium, calcium, but looks like it's not going away or
Yeah.
reducing.
So to be pigmentation ka the reason is not vitamin or mineral deficiency. It's more hormonal. Okay, along with the diet, sun, and the hormone changes which take place during the pregnancy. So taking supplements is good, there's no doubt. But if it's not helping, if you feel the pigmentation is still there, then you'll need to start using some active creams like locally to lighten it.
Okay. Okay, thank you. I think, yeah, that's it because all the other questions are kind of like repetitive.
Repeat.
The same thing about, yeah, actually, we can sort it out. Like, there's one big chunk of people asking about skin
Stretch.
darkening and pigmentation, and the other huge chunk is asking about stretch marks. And then in between, we had a few other questions which we've already answered. Yeah, so those are
Hmm.
all the things. We just had one
There's
question.
one question here
Hair
on
fall
hair fall postpartum.
postpartum. Could you please suggest some effective methods to prevent this?
Yes. So first we need to understand the postpartum hair fall is very normal. It's kind of not, I won't say it's physiological, but it's very common, okay, in most of the cases. So during pregnancy, as we discussed, hair is in the best phase. It grows, it's healthy, it grows so fast, there's no fall, nothing, because the hormones. So once those hormones go, which is bound to happen once you deliver the child, the good hormones are gone, and then the hair starts going into the shedding phase, and that's why the fall happens. Okay, plus the whole stress of delivery, losing all your vitamins, nutrients with the baby, and all of this, of course, is a part of it. Bleeding, your iron levels go low,
No
all of
sleep.
this. Yes, so these all things can aggravate the fall also. So what you can do post. First, most important, start taking good vitamins. Okay, make sure your B12, D3, iron levels are in good control. Okay, if needed, if they are low, start supplementing. Along with that, start taking a good hair vitamin to stop the fall. Usually, most of the cases in maximum 3 months, this hair fall stops also, provided you're providing good nourishment to your body, because then you will be feeding also. The more nutrition is going to go. So you have to add on your supplements. So make sure you're eating fine, sleeping fine. Once your body recovers, as your body will recover postpartum, the hair fall will also stop. And most of this hair which is fallen, it comes back also, provided you are healing your body, you're nourishing your body. If you don't do anything for that, the healing or the repair and the growth will not happen. Then you lose a lot of volume. Otherwise, it comes back.
Okay, yeah, as you mentioned, doctor, consumption of vitamins or finding out if you're at a deficiency of any kind of vitamin, that has to be done with consultation of a specialist, right? It's not
Yes, yes,
advisable
yes.
for you yourself to go and get yourself tested and then just
No,
start.
no, no.
Yeah.
Speak to your doctor, get yourself tested, and yeah, because this is one of the common reasons for aggravated postpartum hair fall.
Yeah. Yeah, and all of you all who are here, Dr. Swati is available online. So if you have to have any consultation with her,
Yes.
you can contact her directly. She will be she should be able to respond to you. And if you want if you're not able to find her, you can contact New Mother and we can redirect you to her. Yeah.
Yeah.
Yes, surely.
There was one question regarding under eye problem. There, she has darkness under her eyes.
Okay.
During pregnancy or just?
Yeah, she didn't mention that it was really in the beginning of the session. Yeah.
Okay.
Okay, maybe we can talk, we can address during pregnancy since we are talking about pregnancy. Yeah.
Sure. So again, darkness can be part of the whole pigmentation, plus the sleep not being the best during pregnancy because of discomfort and all of this. Or sometimes initially because of nausea, when you lose weight first 3-4 months, it's just the hollowness ke karan your dark circles and all of that also looks much more. B12 deficiency can also cause darkening around the eyes. So these are the common reasons. Screen time, of course, we all know. And then depending on the reason, first 3 months, I would suggest make sure you're sleeping better, giving enough rest to your eyes. If still the darkness remains, then we can look at a good eye cream. Again, after speaking to your doctor, you can start some eye cream after 3 months.
Okay.
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 We
Yeah,
have
there's a lot
actually,
of questions
yeah,
actually. Dr. Swati must be tired. I think this was one session where we had so many questions
so many
back to back,
questions.
back to back. Yeah.
Yeah, it's a very
Yeah.
common concern, no? Skin and hair,
Yeah.
like,
Yeah.
A
Okay,
main
we got
concern actually.
another, we've got another one from
Yeah.
her. Could you please suggest best supplements with biotin that is actually effective? I was suggested perfect till.
perfect.
Is it good enough?
Yes, Perfectil is good. There's something called as Glow Eva also. That's also very good. These both are safe while you're feeding the baby also. So don't just take any vitamins also. Again, you have to check if you can feed while you're taking the supplements also. Not all supplements are safe while feeding.
Okay. Thank you so much, Dr. Swati. We've already extended the time of our session. Thank you so much for being so
Okay.
patient and answering all
Thank
the
you so
questions.
much. It was a
Um,
very good session.
yeah.
Yeah, just last one more question. Okay. Has become, hi ma'am, my neck has become dark at the time of pregnancy and after postpartum also, and my color also reduced. I think overall
Mm.
skin color she means.
Has reduced.
Yeah,
Yeah.
basically, I think she's talking about turned into a darker tone or something because she's talking
Yeah.
about, yeah.
Huh. So, see, one as I discussed it, the reason could also be maybe you've not gone back to your pre-pregnancy weight, or just near that weight. You're still holding on to that pregnancy weight, and not your metabolism somewhere has not come back to the normal self. So look into that. And other thing is, if you feel there's a genuine still darkening, like really dark, could be that you have to rule out gestational diabetes or the insulin resistance. Sometimes it goes undiagnosed and later you realize it, that can lead to the darkening which doesn't get back to normal. If all of that is fine, it's just a darkening, then you can do some creams, enough available, enough options to lighten it.
Yeah.
Okay.
Yeah, thank you, Doctor. We are continuously getting questions. Guys, if
One
you have any
last.
further questions, please
Well,
Yeah,
send
I
it.
have one last one.
okay,
Okay.
okay.
Okay, just in general, I mean, during pregnancy, is there any, I mean, any chemical ingredient that has to be completely avoided, which they can check on the ingredients list?
Yes, many.
Something called as retinol. It
Okay.
has to be avoided strictly. Okay, because it is known to cause harm to the baby. So that
Okay.
is
That's
to be
I think
strictly
common
avoided.
ingredient in anti-aging creams, I guess.
Anti-aging,
Right?
anti-acne, a lot of stretch mark creams, which are medicated stretch mark creams,
Yeah.
also have. So there are certain stretch mark creams which are safe during pregnancy, and some of them which you use post the pregnancy have retinol, which normally can be used. A young guy who's gymming and all gets stretch marks, we give them retinol-based creams. But
Hmm.
because he's been given for stretch mark, that doesn't, it's not safe for somebody who's pregnant. So
Okay.
during pregnancy, you can't. Post delivery, you can use retinol. But when you're pregnant, something, because acne applications also have retinol.
Okay.
Okay.
Okay. Thank you so much for that, Dr. Swati. Like, yeah.
Right.
Yeah, those were
If
a
you
lot
guys
of
have any more
questions.
questions, please feel free to
Yes.
message me directly and I will try my best to answer them.
Yeah, even if
Definitely.
we get any further questions, we will redirect them to you. We can
Sure,
tag
sure.
you in those comments.
Perfect.
Thank you so much, Dr.
Thank
Swati.
you.
A lovely, 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 lovely session. I guess,
Same
it
here.
was so much full of knowledge, and I'm sure that all the people who watched it and who will watch it later, because most of the people tend to watch it later on. Yeah,
Yeah,
so all
yeah.
of you who are going to watch it, I'm sure they're going to, benefit a lot from this session. Thank you so much for being with us and being so patient and answering all the questions so beautifully. Thank you so much.
Thank you.
Yes.
Thank you, both of you. Thank you so much. All
Thank
the
you.
best. Bye.
Happy
Thank you.
weekend.
And thank
Bye.
you everyone
Yeah,
for
thank you.
joining us.
Thank
Yeah,
you.
bye. Bye.